This video is about rotator cuff syndrome. Rotator cuff syndrome is a very common shoulder injury. Shoulder joint is a relatively unstable ball and socket joint that's moved and controlled by a small group of four muscles known as rotator cuff and that are responsible for shoulder rotation and cuff around head of the humerus. Causes of rotator cuff syndrome could be degeneration with aging or inflammation due to tendinitis, bursitis, and arthritis, trauma, repetitive overhead activities, or overuse muscle fatigue. What is rotator cuff? Group of muscles and tendons that surround the shoulder joint and serve as a dynamic stabilizer of humerus and keeping the head of the humerus within the shallow socket of shoulder. Rotator cuff is comprised of four muscles: supraspinatus, infraspinatus, subscapularis, teres minor. Rotator cuff muscles. This diagram shows rotator cuff muscles: supraspinatus, infraspinatus, teres minor, subscapularis. The muscles of rotator cuff. This table shows the origin, insertion, nerve action and action of nerve supply and action of rotator cuff muscles. Number 1, supraspinatus. Origin supraspinatus fossa, insertion greater tuberosity, nerve supply suprascapular, action abducts the arm, initiation. Infraspinatus. Origin infraspinatus fossa, insertion greater tuberosity, middle, nerve supply suprascapular, action external rotation of arm and provides stability. Muscle teres minor. Origin lateral scapular, insertion greater tuberosity, nerve action axillary nerve and action external rotation of arm, stability. Fourth, subscapularis. Origin subscapular fossa, insertion lesser tuberosity, nerve action upper and lower subscapular, action internal rotation, adduction of arm and stability. These are the rotator cuff muscles. First diagram shows supraspinatus bilaterally, second diagram shows teres minor, third shows infraspinatus, fourth shows subscapularis. This also shows rotator cuff muscles from posterior and anterior view. From anterior view you can see subscapularis and from posterior view you can see supraspinatus, infraspinatus and teres minor. This diagram also shows the muscles. Rotator cuff injuries. Common rotator cuff injuries are rotator cuff tendinitis, rotator cuff impingement, rotator cuff tear, calcific tendinitis, shoulder bursitis. This diagram shows different injuries related to rotator cuff. This is how impingement syndrome happens. This is the rotator cuff tear, overuse tendinitis. Rotator cuff impingement, a condition where rotator cuff tendons are trapped and compressed during shoulder movements. This causes injury to shoulder tendon and bursa, resulting in painful shoulder movement. Signs and symptoms of rotator cuff impingement are an arc of shoulder pain or clicking when arm is at shoulder height or when arm is overhead. Shoulder pain that can extend from top of your shoulder to your elbow. Shoulder pain when lying on your sore shoulder. Shoulder pain at rest. Shoulder muscles weakness or pain when attempting to reach or lift. Shoulder pain when putting your hand behind your back or head. Shoulder pain reaching for seat belt. Rotator cuff tendinitis that affect the tendons and muscles that help move your shoulder joint. It means tendons are inflamed or irritated. Causes: keeping shoulder in one position, lifting your arm over your head, sleeping on your shoulder every night. Sign and symptom: Pain and swelling in front of shoulder and side of arm. Pain triggered by raising or lowering your arm. Stiffness, loss of mobility and strength in affected arm. Pain when reaching behind your back. Rotator cuff tear. A tear of one or more of the tendon of the four rotator cuff muscles. Tendons are mostly involved, muscles are not commonly involved. Supraspinatus is most frequently affected as it passes below the acromion. Tear usually occur at the point of insertion onto humeral head at greater tubercle. Risk factors. Sudden strain movements of shoulder against resistance, including lifting weight, lifting overhead, tennis, swimming, throwing objects, etc. And this syndrome is diagnosed by manual muscle testing, X-rays, ultrasound, MRI, specific rotator cuff muscle test. Rotator cuff muscles test. First test could be supraspinatus jobs. For supraspinatus jobs or empty cane test. Arm anteriorly flexed at the level of the shoulder. Patient pronated the arm into empty cane position with thumb pointing downward. Patient resists the downward force being applied on forearm by examiner. Pain or weakness during test indicates supraspinatus lesion. Infraspinatus muscle test. Testing the external rotation of the shoulder with arm to the side against resistance. So examiner passively rotate the arm into full external rotation. A positive test result indicated when examiner releases the patient arm, the patient unable to maintain the position of full external rotation. Teres minor test, that is also called the Hornblower's test. External rotation is tested with arm 90 degree abduct with elbow flexed. A positive test result indicated if the arm fall into internal rotation. Subscapularis muscle test, also known as belly press test or bear hug test. Bear hug test performed in that position and belly press maneuver performed in that position. Belly press test. So subscapularis is an internal rotator of shoulder. There are several tests of subscapularis. The first test is known as belly press test. The patient is standing with the hand of the affected arm rested against the stomach with the elbow anterior to the mid-axillary line. The patient is then asked to press the belly against the affected arm without moving the elbow. Failure to maintain the elbow anterior to the mid-axillary line while pressing against the belly indicates predominantly a subscapularis tendon tear. Bear hug test. Another test for subscapularis muscle is referred to as bear hug test. During the bear hug test, the patient is asked to place the palm of the hand onto opposite shoulder with the elbow anterior to the body. The patient will maintain the internal rotation of shoulder in this position and the examiner will then attempt to externally rotate the arm. A positive test result is indicated when the patient shows the weakness of arm compared to opposite arm. Lower subscapularis muscle test, also known as lift-off test. Lift-off test is a good test for the lower subscapularis muscle. During the lift-off test, the patient is standing with the affected arm internally rotated behind the back, so the dorsum of the hand will be resting on the lumbar area. The examiner will passively lift the arm away from the patient's back. Once the examiner releases the arm, failure to maintain the position of the arm away from the back will indicate a subscapularis tendon tear. Nears test. Rotator cuff muscles and tendons. Structures that Nears test check are rotator cuff muscles and tendons. Position of the patient is lying, patient is sitting. Therapist stands in front of patient. Application. Therapist passively brings the shoulder into full flexion and internal rotation. Positive sign is reproduction of pain. Flexion, jam test or impingement test. Structure which it checks supraspinatus or biceps. Position, patient is sitting, the therapist stands in front of patient, just like the picture. Application, the patient raises the arm into the full flexion. The therapist then forces additional shoulder flexion at end of range. Positive test is reproduction of pain. Salute test. It checks rotator cuff muscle and tendon. Position is patient is sitting at the edge of the table. The therapist standing behind the patient. Application. The patient flexes the shoulder to 90 degree, externally rotates and horizontally abducts, just like the picture, and the therapist applies resistance to the patient's hand, thereby resisting the external rotation. Positive sign. The pain reduced with the resistance to the patient's hand. Job arm test. It checks rotator cuff overall position, or specifically for supraspinatus. Position of the patient. Patient is sitting. The therapist stands behind the patient, just like the picture, and the application is therapist positions the patient arm in 90 degree of abduction. He then asks the patient to slowly lower the arm to its side. Positive sign. The patient is unable to lower arm smoothly or has a significant pain while doing so. X-ray finding. X-ray projectional radiography cannot directly reveal the tears of rotator cuff, a soft tissue, and consequently normal X-rays cannot exclude a damaged cuff. However, indirect evidence of pathology may be seen in instances where one or more of the tendons have undergone degenerative calcification, that is called calcific tendinitis. The humeral head may migrate upwards. High riding humeral head secondary to the tears of infraspinatus or combined. Projectional radiography. Projectional radiograph of the normal glenohumeral position and high riding humeral head in a rotator cuff tear. MRI of rotator cuff tear. Treatment depend upon severity of condition. Physiotherapy treatment, medical treatment that could include NSAIDs, cortisone injection. Third, surgical treatment, tenotomy, hemiarthroplasty, total shoulder arthroplasty. Physiotherapy treatment. Physiotherapy keeps you moving. Physiotherapy treatment includes rest, icing, RM exercises, mobilization, electrical modalities, stretching exercise, strengthening exercise, kinesiology tape. Exercises include stretching exercises, which includes pendulum exercises, 2 sets of 10, and days per week 5 to 6. Main muscle walk, deltoid, supraspinatus, infraspinatus, subscapularis. Crossover stretch, repetitions 4 each side. Days per week 5 to 6. Muscles involve posterior deltoid. You should feel this at the back of your shoulder. This is performed like this. Passive internal rotation. You can use light stick, yardstick for this purpose. Main muscle involves subscapularis. You should feel stretch at front of your shoulder. Repetitions 4 each side. Days per week 5 to 6. Passive external rotation. This is also done with light stick, yardstick. Muscles involved in infraspinatus teres minor. You should feel the stretch in back of your shoulder. Repetition 4 each side. Days per week 5 to 6. Sleeper stretch. Repetitions 4 repetitions 3 times a day. Days per week daily. Main muscles involved in infraspinatus teres minor. You should feel the stretch in your outer upper back behind your shoulder. This is performed like this. Strengthening exercises. Standing row. Main muscle involved, middle and lower trapezius. You should feel this exercise at back of your shoulder and into your upper back. Repetition 3 sets of 8, days per week 3. Equipment needed. Use an elastic band of comfortable resistance as the exercise becomes easier to perform. Progress to 3 sets of 12 repetitions. If you have an access to a fitness center, this exercise can also be performed on a weight machine. A fitness assistant at your gym can instruct you how to use the machine safely. External rotation with arm abducted. Main muscles involved in infraspinatus teres minor. You should feel this exercise at the back of your shoulder and into your upper back. Equipment needed. Use an elastic band of comfortable resistance as the exercise becomes easier to perform. Progress to 3 sets of 12 repetitions. Repetition 3 sets of 8, days per week 3. External rotation. Main muscle involved in infraspinatus teres minor, posterior deltoid. You should feel the stretch in back of your shoulder and upper back. Equipment needed same. Repetition 3 sets of 8, days per week 3. Elbow flexion. Repetition 3 sets of 8, days per week 3. Main muscle involved biceps. You should feel the stretch at the front of your upper arm. Equipment needed: begin with a weight that allows 3 sets of 8 repetitions and progress to 3 sets of 12 repetitions. As exercise becomes easier, add weight in 1 pound increments to a maximum of 5 pounds. Each time you increase the weight, start again at 3 sets of 8 repetitions. Elbow extension. Main muscle involved tricep. You should feel this exercise at the back of your upper arm. Equipment needed: begin with a weight that allows 3 sets of 8 repetitions and progress to 3 sets of 12 repetitions. As exercise becomes easier, add weight in 1 pound increments to a maximum of 5 pounds. Each time increase the weight, start again at 3 sets of 8 repetitions. Repetition 3 sets of 8, days per week 3. Trapezius strengthening. Main muscle involved middle and posterior deltoid, supraspinatus, middle trapezius. You should feel this exercise at the back of your shoulder into your upper back. Equipment needed: begin with a light enough weight to allow 3 to 4 sets of the 30 repetitions without pain. As exercise becomes easier to perform, add 2 to 3 pounds of weight but do fewer repetitions. Progress to 3 sets of 15 repetitions at each weight increment with the maximum weight approximately 5 to 7 pounds. Days per week 3 to 5, repetition 3 sets of 20. Scapula setting. Repetitions 10, days per week 3. Main muscle involved middle trapezius serratus. You should feel this exercise in your upper back at your shoulder blade. Scapular retraction protection. Repetitions 2 sets of 10, days per week 3. Main muscles worked middle trapezius serratus. You should feel this exercise in your upper back at your shoulder blade. Equipment needed: begin with a weight that allows 2 sets of 8 to 10 repetitions and progress to 3 sets of 15 repetitions. As exercise becomes easier, add weight in 1 pound increments to a maximum of 5 pounds. Each time increase the weight, start again at 2 sets of 8 to 10 repetitions. Bend over horizontal abduction. 3 sets of 8 repetitions, days per week 3. Main muscle work middle and the lower trapezius, spinatus, teres minor, posterior deltoid. You should feel the exercise at the back of your shoulder and into your upper back. Equipment needed: begin with a weight that allows 3 sets of 8 repetitions and progress to 3 sets of 12 repetitions. As exercise becomes easier, add weight in each 1 pound increments to a maximum 5 pounds. Each time you weight the exercise, start again at 3 sets of 8 repetitions. Internal and external rotation. Rotator cuff stretch. Kinesiology tape for shoulder and rotator cuff. Kinesiology taping is a simple, effective, and inexpensive treatment for shoulder and rotator cuff pain. The thin, flexible tape is applied over and around the affected muscles and provide pain relief and support without restricting the range of motion. This allows many athletes with the shoulder injuries to continue to train and compete as they recover. Kinesiology tape can also improve the ability to participate in physical therapy. Kinesio tape, pre-cut shoulder tape. Kenmax pre-cut shoulder tape. Spider Tack pre-cut shoulder tape. Complications. What are complications of the rotator cuff disease? The most serious complication of rotator cuff disease is frozen shoulder. Frozen shoulder is a result of scarring that occurs around the inflamed joint and leads to loss of ROM and function of joint. Frozen shoulder is also referred to as adhesive capsulitis. Precautions. Long-term overuse of the shoulder joint is generally thought to limit the ROM and productivity due to daily wear and tear of the muscles. And many public websites offer preventive advice. Recommendations include regular shoulder exercises to maintain strength and flexibility, using proper form when lifting or moving heavy weights, resting the shoulder when experiencing pain, application of the cold packs and heat packs to a painful inflamed shoulder, strengthening program to include the back and shoulder girdle muscles as well as the chest, shoulder, upper arm, adequate rest periods in occupations that require repetitive lifting and reaching. Thank you. I hope you like the video.